Welcome to Everyday Nursing Knowledge Lectures, and today we will learn blood supply to the brain. Brain gets 15% of the cardiac output and it is supplied by two main arteries, that is internal carotid artery, you can see here internal carotid artery, and vertebral artery, the back. This is the vertebral artery. Internal carotid artery supplies 80% of the blood to the brain, whereas vertebral artery supplies 20% of the blood. Internal carotid artery supplies to the anterior portion of the brain, whereas vertebral artery supplies the posterior portion of the brain. If you look at the anatomy, this is the arch of aorta, and on the right side, brachiocephalic artery arises from the arch of aorta. It bifurcates into right subclavian artery and right common carotid artery. So this is a picture of right common carotid artery on the right side. And at the level of C4, it bifurcates. It divides into external carotid artery and internal carotid artery. So this is external carotid artery, rises from common carotid artery, bifurcate at the level of C4. And external carotid artery supplies face, scalp, and skull, whereas internal carotid artery supplies the brain. Now on the left side, the common carotid artery, it arises from the arch of aorta. It ascends up again at the level of C4. It bifurcates into internal carotid artery, supplies the brain on the left side, and external carotid artery supplies face, scalp, and skull on the left side. Now vertebral artery at the back, you can see it arises again from the subclavian artery on both sides. So this is subclavian artery on the right, subclavian artery on the left, and the vertebral artery arises from the subclavian artery both sides and ascends through the vertebrae and supplies the posterior portion of the brain. So here is a picture of internal carotid artery and supplying the anterior portion of the brain. It supplies the cerebrum, the anterior portion of the cerebrum, and eyes. And as it goes up, it's divided into different parts. You can see different parts or different segments of internal carotid artery. And it branches into multiple arteries. That is, ophthalmic artery supplies the eyes, posterior communicating artery, anterior communicating artery. But it divides into two main branches or two terminal branches. These two main branches are MCA, that is middle cerebral artery, and ACA, anterior cerebral artery. These two branches are the main or the terminal branches of internal carotid artery which supplies the cerebrum. MCA, the middle cerebral artery, is the largest branch of internal carotid artery. Now let's see the area supplied by these two arteries. So ACA, which is colored in yellow, it supplies the anterior and the medial. Medial means towards the midline. Anterior and midline portion of the cerebral cortex to or back to the parietal lobe. ACA is the least common site affected by the stroke, and as it goes up, it's divided into three segments, A1, A2, A3 segments. And if there is a ischemic stroke affecting ACA, that is anterior cerebral artery, it can lead to contralateral paresis. That means if right ACA, right side of the anterior cerebral artery is occluded, it can cause left side weakness or sensory loss in the extremities, legs, cognitive personality changes, and incontinence. Now let's see middle cerebral artery. So anterior cerebral artery and middle cerebral artery are the branches of internal carotid artery supplying the cerebrum. Now coming to middle cerebral artery, MCA supplies the lateral part of the cerebral hemisphere. In this picture, it's colored as pink. Lateral view or lateral side of the cerebral hemisphere, and Broca's area and Wernicke's area of the brain. Broca's area of the brain helps with the speech production, and Wernicke's area helps with speech understanding. So the MCA is the most common occlusion site, and as it goes up, it's divided into MCA is divided into four segments, M1, M2, M3 segments. Now, if there is an occlusion in the MCA or MCA stroke, it can cause contralateral. That means if there is a right MCA stroke or occlusion to the right middle cerebral artery, it causes left-sided weakness, hemiplegia, or numbness in the extremities. And if supply to the Broca's or Wernicke's area is impaired or occluded, patient can have speech deficits. Now, before going to posterior cerebral artery, let's look at the vertebral arteries. Now, the vertebral arteries arises from the subclavian artery on both sides, right side and left side. And it supplies the posterior portion of the brain, that is your occipital lobe, cerebellum, brainstem, and upper part of the spinal cord. Vertebral arteries, it is a picture of two vertebral arteries, right side and left side. Vertebral arteries give multiple branches, that is spinal artery. Spinal artery provides blood supply to the upper part of the spinal cord. Meningeal artery, this is meningeal artery, supplies the meninges. Medulla arteries, medullary artery supplies the medulla oblongata, and posterior inferior cerebellar artery. This posterior inferior cerebellar artery supplies posterior and inferior portion of the cerebellum. These two vertebral arteries join together at the base of the skull to form basilar artery. So vertebral arteries on both sides join together to form basilar arteries. So vertebral arteries supplies the posterior portion of the brain. These two vertebral arteries join together to form basilar arteries. Now, basilar arteries also has multiple branches. Pontine arteries, anterior inferior cerebellar artery, which supplies the anterior inferior portion of the cerebellum. Superior cerebellar artery, again the superior portion of the cerebellum, and one of the main branches. This supplies the posterior portion of the brain. This arises from vertebro-basilar artery. So anterior cerebral artery and middle cerebral artery arises from internal carotid artery, which supplies the ACA supplies the anterior and the medial portion of the brain, whereas MCA supplies the lateral brain, whereas posterior cerebral artery supplies the posterior portion of the brain, that is the occipital lobe and inferior portion of the temporal lobe, which is colored as blue. Now, finally, circle of Willis. This is a picture of circle of Willis. Here is two vertebral arteries joined together to form basilar artery. Vertebral arteries joined together form basilar artery, and this is the internal carotid artery, which branches into ACA and MCA. So the arteries of the brain join together at the base of the brain to form a circle, and this is known as circle of Willis. The vertebro-basilar artery and the internal carotid artery join together to form a circle at the base of the brain. This anastomosis is known as circle of Willis. So today we learned about blood supply to the brain, and thanks for watching my video.